Hi, my name's Candace, and I'm the treatment coordinator in the office, and I just want to welcome you to Advanced Orthodontics. We're so excited to have you as part of our orthodontic family here, and we know that you're getting ready to come in soon to get your braces bonded. So I just want to spend a few minutes just to kind of let you know what to expect at your braces bonding appointment. What we do is one of the first things that we're going to do is we're going to go ahead and place a cheek retractor in your mouth. So what that's going to do is it's going to keep your lips and your cheeks out of the way so that we can have better isolation to try to keep your teeth dry. Obviously, your mouth is not dry, it's a wet field, but we're going to do everything that we can to keep it as dry as possible so that when we bond your brackets that they'll not fall off. So one of the first steps in that is we're going to have a little blue gel. It looks like it has a little tip on the end. That is not a shot. So we always want to make sure people know that so you're not fearful of it, but it's just going to squirt a little blue gel on your teeth. It's kind of like opening up the pores on your teeth. And so it's just the first step in getting a really good bond. It is a little sour, not in a good way, not like sour candy. And so we do our best to try to make it to where you won't taste it, but you still might taste that a little bit when we're rinsing it off your teeth. The next step is we have a bonding agent that we just go ahead and we have a little micro brush and we just dip it in there, and then we'll just go ahead and rub that onto your teeth, and then we'll dry your teeth after that. And then we get ready to place brackets. So what we use is we just use a tooth colored composite as glue. We just put a little bit behind the bracket pad, and then we place those onto your teeth. So usually your clinician will get them all placed and ready, get the teeth all prepped ahead of time. And once the brackets are on your teeth, then the doctor is going to come over and they're going to place that bracket very specifically to get the tooth to move the way that they want to. And so you're going to have brackets that'll be placed usually on the lower and the upper. Occasionally it might be one arch or the other. And after we're done placing the brackets, we'll go ahead and get you a good rinse. We'll get everything out of your mouth, the retractors, and then we're usually going to go ahead and put wires in. And so with the type of brackets, depends on, some of our brackets are what we call self-ligating brackets. So if you're usually getting a full comprehensive treatment with braces, then what that means is that we don't need the color ties to tie the wire into the bracket. A lot of our patients still want them. Yes, you can still have them. We're not going to take that away from you if you want it. But we just lay the wire in there, and then there's a little door in the bracket that will shut over the wire. And then some of the brackets, if maybe it's a phase one, a first phase of treatment, then you might still have the kind of brackets where we need the color ties to tie the wire into the bracket. Once we have the wires placed in the brackets, that's when your teeth are officially moving. So what you can expect after that is within about 2 to 4 hours, your teeth will generally start to feel pretty sore. Brackets and wires are a lot of force all at once. So you'll just kind of have a couple of first days where it's just a little bit sore and tender. So what we recommend is that you have food and drink at home on hand that's easy to eat by swallowing only. Applesauce, yogurt, smoothies, mashed potatoes. It'll just make it a little bit more comfortable for you. And generally whatever your parent might give you for a headache should help with that as well. And then, a couple days, maybe third, fourth day, the inside of your lips and your cheeks might rub against the brackets a little bit. That's totally normal. We're going to give you a little care kit. And in the kit, you're going to have some wax. And the wax is something that we can use to kind of put around the brackets. And I'll show you an example of that in just a moment. And that will kind of also help you with those first few days of discomfort. Generally, it's about 7 to 10 days, and you should be pretty well adjusted. And then really, it should be fine after that. It's usually not too uncomfortable moving forward, and it's just that initial adjustment. A couple things to keep in mind with braces is that when you leave here, brackets are a little bit fragile, so you are going to want to be very mindful of what you're eating. So we don't want to have anything that's gummy, sticky, chewy, hard, or crunchy. So we want to be careful of nuts. We will have a foods list that we will give you that can go home with you, and it will kind of list everything on there. But basically, stay away from hard nuts, hard chips, candy, fruity flavored candy, meat cut off the bone, corn cut it off the cob. And we'll just kind of go over that at your bonding appointment when you're here in the clinic. The clinician will walk you through all of that. I do want to show you a little bit of kind of how to use the wax, how to clean your teeth and to floss. It's a little bit more challenging with braces. So generally, when you're brushing, you're going to brush like you normally would. You're going to brush on the biting surface of your teeth. you're going to brush behind your teeth, and you're going to brush across the front of your teeth. Like, all of that is still normal. What you're going to want to do in addition to that is you're going to want to angle the bristles of the toothbrush on top of the bracket, on top of those wings. And you're going to do that on top and underneath. And you're going to do that for both the top and the bottom. That's where all the plaque wants to build up. And so we want to make sure that we're doing a really good job removing that to avoid any kind of decalcification on your teeth. Then the next thing that we have is wax. You'll get a little packet of that in your kit. And really just what you need is a really tiny amount. You just kind of ball it up. And what you're going to do is you're just going to go ahead and place it wherever that bracket might be rubbing or scratching you. And you just kind of push it in there and just get it to kind of sit over that. And if you pack it in there really well, it can generally last you most of the day. You could swap over and get new wax for the evening. Wax kind of helps you with the initial adjustment period. Most of the time you won't need it throughout the treatment. The inside of your mouth will kind of build up little calluses. But for those who tend to lean a little more heavily on the wax, I'd recommend having toothpicks at home because sometimes it can be a little challenging to get it out. Okay, so one more thing with keeping your teeth clean is the flossing. So there's multiple different flossing aids. One of them that we have right now that I'm going to show you is a floss threader. Generally with a floss threader, it's a plastic needle. If you think of like sewing needle and thread, you can reuse it multiple times before you throw it away. You just need a new piece of floss every time. There are also things called super floss where you can get it in bulk at most any drugstore. It's pre-cut piece of floss, stiff on one end. So that's another option as well. So what you want to do is you're going to go ahead and you're going to take that plastic needle and you're going to go underneath the wire. And then what you'll do is, the model won't let me do it all the way, but you would go down between the teeth till you get near the gum tissue. And then you would wrap around like a C going one direction, lift out, then go to the tooth on the other side, wrap it around like a C. And then you would go ahead and pull it out. And then you're going to go between the next two teeth. And you're just gonna do that, just moving all the way across from one side to the other. It does feel a little time consuming in the beginning, but the more that you do it, the quicker it'll get and the more efficient you'll become at it. The next thing I just wanna talk about is orthodontic emergencies. So with brackets, sometimes what can happen is if a bracket comes loose, if it's a back bracket, it could be pretty uncomfortable because there's nothing stabilizing the wire in the very back. We don't want you to feel like you're having to go a long weekend or a long period of time with that. So what we would do is we would generally get you in. We would go ahead and rebond that back bracket. If it's after hours on a weekend or a doctor is not present, we can at least clip the wire to make you comfortable. Anywhere else that a bracket might come loose, it shouldn't be painful. You might just feel a little shift of pressure. One of the best things is just being really careful with what you're eating and how you're eating to avoid having brackets come loose. Another thing that can happen is just poking wires. Generally, when we place a wire in the mouth, the teeth can have rotation. So sometimes that wire is flexing up and down, in and out. And as things are aligning, then that wire will start to level. And so what's happening is that extra wire now is being pushed towards the back of the mouth. Doesn't mean you did anything wrong. And so just give us a call if that happens. We'll generally just, schedule you to come in and just clip that wire in the back for you. Okay, so that's it for today. We just want to say thank you so much for choosing us. We just want to welcome you to Advanced Orthodontics, and we look forward to seeing you soon at your braces bonding appointment.